I'm Robert with Self-Care Therapy. We're a lymphedema therapy clinic, so we work with people that have swollen legs, swollen arms. We treat that, and then pretty much all of our patients have to wear compression of some sort to keep the swelling from coming back, because often it is a chronic condition. This is a product review of a product called the Farrow Wrap Basic. It's sold by Jobst. There are many similar products on the market. The purpose of this video is just to mention some of the pros and cons with this specific one if you're trying to decide which one to get. If you want instructions on how to actually put this garment on, there will be a link at the end of this video to instructions, or you can find them at selfcaretherapy.com. So first, some pros and cons of going with a Velcro closure wrapping system for compression. This one is for a leg below the knee. To decide if you want to use a Velcro closure compression versus an elastic compression, some of the benefits of Velcro is that they can be easier to put on because you're not sliding them onto your leg, but rather buckling them on. The other obvious benefit is that they are adjustable. So if the swelling fluctuates and you're not quite able to keep it down with an elastic, these allow you to actually reduce your swelling. So it's often a good place to begin to reduce swelling, but it can also be used to keep swelling down when it's used properly. I have another video on non-elastic compression garment is what it's called. So the Farrow Wrap, compared to some of the other ones that we have used in the clinic, one of the main differences that we have found is the way that the Velcro straps overlap. So a lot of the other ones, they have maybe 4 straps that buckle together more like this. These actually overlap. So you start at the bottom, and as you'll see in the instructional video, when you buckle this onto your leg, you start down at your ankle. The next strap will then overlap quite a bit, as you can see here. The benefit of that is that it's pretty much impossible to have a gap between the straps. And gaps between the straps can really wreak havoc on a swollen leg. And that is a problem that we've seen with some of the other Velcro closure garments, is that if they're not put on properly and there is a gap, the fluid always takes the path of least resistance, and we have seen blisters form on our patients. Anywhere where that skin is exposed, swelling will find its way to there, and they will be like a bulging swelling or maybe even a blister, which then could pop into an open wound. So we feel like this product has really found a good solution to that problem, where they're sewn together in a way that you really cannot leave any gaps with exposed skin. So what would some of the downsides be? Of course, there's a lot more straps, so it will take a little bit longer to put this on. So this particular one has 6 straps on it versus maybe 4 on some of the other ones. So a little bit more time consuming to put them on. A benefit with this compared to the other ones is also the liner system. So most of the other products on the market, not all of them, but most of them have 3 parts. They have a liner that goes onto your leg, then they have a compression anklet that goes on your foot, and then lastly you put the legging piece on. With the Farrow Wrap, you only have 2 parts. What they've done is they've combined the leg liner part with the foot compression part. So in this little package there's a sock, which basically looks like a regular knee-high sock, but the difference between this and a regular sock is that the compression is only in this part of it. So in other words, there's only compression in the foot and the ankle. This part of the sock is just like a liner. It doesn't have a lot of compression. So these are fairly easy to put on. You can actually put these on with a regular sock aid. It doesn't need to be like a specialized device for compression garments, but for most people a regular sock aid will work, and a lot of our patients actually pull these on with their bare hands or just using gloves. And If you're not familiar with the devices I'm talking about and the gloves, check out our website, selfcaretherapy.com. We have all those devices there with other videos to explain that. So in short, we've really come to like this version, and a lot of our patients do use it. You do have to be able to reach down to your ankle. If you can reach your ankle and work there to get that first bottom strap on, then you should be able to put them on. It does also take some dexterity in your fingers, so you have to be able to pull one strap, pull another strap over it. You also, I'm going to toss that on the floor, you also have to have enough pinch strength to undo the Velcro. It's a pretty strong Velcro, so it comes with these Velcro tabs. So, and it sticks pretty hard. So when it's buckled together, you do have to have a little bit of pinch strength. It's not super tight, but you have to be able to pinch and pull. So if you have a real problem with rheumatoid arthritis in the fingers, that could be a challenge for this product, since it does take some fine motor and dexterity to handle it. One thing we also really like with this product is the price point. They sell at our website right now for $68, which is really a lot less than a lot of the similar products on the market. So that kind of opens the door for this product for a lot of our patients also. That is $68 per leg, so if you need two, it still is twice that. But we often use this also when we have patients that perhaps live really far from the clinic and they're not able to come in for treatment that consists of wrapping and massaging and using the compression pump. This is an alternative for self-treating swollen legs at home that can work pretty good if the condition is not really severe. So very good product that we often recommend. Hope you enjoyed this video. Check out more videos at selfcaretherapy.com. Subscribe to our channel. We keep posting things that we learn in our clinic, things that can help deal with challenges that come in life because of chronic illness and disability. And that's our goal, is to help as many people as possible be as independent as possible. Thank you for watching.